There is currently no direct cure for fibromyalgia, a chronic condition that can significantly impact daily life. We are happy to welcome back Dr. J.P. Saleeby, Medical Director of Carolina Holistic Medicine, to talk about this somewhat common disorder that affects nearly 4 million Americans. Dr. Saleeby, it's always a pleasure.
Yeah, I'm glad to be here.
So, fibromyalgia, what are the hallmark symptoms that someone should be looking for?
Well, there's usually sleep disturbance and fatigue and brain fog, and predominantly some trigger points that are very tender along the upper part of the back, down the lower back and into the legs. There's certain points that can be mapped out.
Okay, and when you say tender, are they tender to the touch?
Yes.
Okay, so it wouldn't be constituted as like pain, like physical pain?
Oh yeah, physical pain. Folks are pain in their muscles and joints, but if you press on these particular spots, they're very tender.
Okay, and now these symptoms sound similar to rheumatoid arthritis. What is the difference there?
So rheumatoid arthritis, there are some biomarkers that you can collect, blood samples, let's say, and maybe some different criteria that will light up if you've got rheumatism.
Okay.
But there are a lot of overlaps with other rheumatological disorders and fibromyalgia.
Okay, and now if you were to go and get an x-ray, would you see any irritation or any inflammation with fibromyalgia?
Yeah, not typically.
Okay.
There aren't any imaging studies that really highlight fibromyalgia. It's mostly a clinical diagnosis. So the doctor will ask some questions and then do an exam, and that's how it's usually made. There's a old criteria, and then there's now newer criteria for diagnosing this.
And now what is some of that criteria?
Well, like I said, there's things you glean from history, like sleep disturbance, insomnia, brain fog or cognitive impairment, and then pain states, like is there chronic pain for how long? It has to meet a criteria of over a certain number of weeks, and then it can be reproducible by pressing on these spots.
Now, how do you see this manifest?
So we see it more common in females than males, and in women in their 40s usually, more so, and they'll come in with a history of months to years of chronic pain, regional pain syndromes that you can exclude. Like, say, if they're complaining of pain behind the knees, let's say that's one of their main areas, and you've already done an MRI or x-rays and there's nothing there, that kind of leads you to kind of consider this as a diagnosis.
Can this be triggered by another illness?
Absolutely. So it can be triggered by stress. So emotional stress, let's say you're going through a divorce, or you just got fired from your job, or physical stress, either being sick with another illness, or being involved in a motor vehicle accident that can cause some stress. That's a trigger. And what I like to call or refer to as stealth infections, like hidden infections. So things like tick-borne illness, like Lyme disease, could be an underlying factor for what is manifest as chronic fatigue. And to go one step further, I don't consider fibromyalgia a set diagnosis. In other words, there's something deeper than that, and you have to dig a little deeper to find out what the root cause may be. There may be several stealth infections or toxicities that can cause the manifestation of fibromyalgia.
Okay, and now as a holistic doctor, what is your approach to treating fibromyalgia?
So when I see someone come in with that history, I immediately want to ask them if they've been worked up for any underlying causes, like Lyme disease or chronic fatigue syndrome or heavy metal toxicity, mold illness, that sort of thing. And then if not, then I'll pursue that. And I'll start doing diagnostics for working that up, you know, checking their gut, making sure dysbiosis is not in there, causing a stir. So it's a kind of a checklist we do.
Yeah. And now, what are some recommendations you have for us to prevent getting fibromyalgia?
Well, prevention is tough because it's multifactorial. So keeping a healthy immune system, eating properly, avoiding sort of the standard American diet, also exercise, appropriate exercise, not over-exercising, and putting yourself at risk for injury by doing sort of intense ballistic exercise. that's one way for prevention. But I will have to say, some people go down the slippery slope of getting hooked on certain medications like opiates for pain. So that's probably the wrong direction, because it only will go further and further and you'll become addicted to these agents. So an approach using energy medicine like acupuncture, for instance, or herbal remedies that are non-addicting to control pain is the better way.
All right, perfect. Dr. Saleeby, thank you so much, and always check with your primary care physician. Thank you again.
Yeah, thanks.
We're back after this.